Yes, welcome to lecture 2. This is physiology of the cardiovascular system. We shall be speaking about how does the heart pump blood, because we said that the heart plays a major role in pumping blood around the body, organs and dead tissues. As we shall see, this occurs within a cycle that we call or refer to as the cardiac cycle. And if you are speaking about the physiology of the cardiovascular system, meaning how does the heart function? The heart plays a major role in pumping blood around the body, organs, and tissues. For example, we see that it pumps blood to the lungs. Then that blood that comes back from the lungs, which contains oxygen, has now to be supplied to other parts, organs of the body, and tissues that require now that oxygen. And that role is played by the heart. I'm Kulak Artery, I'm a scientist. The cardiac cycle we shall discuss in terms of phases, and we shall see that those phases we have the systole and the diastole. We shall know when the heart contracts, which term we give it, when the heart relaxes, which term we use. We shall discuss about the ECG, which is the electrocardiography, which is the electrocardiography. So the cardiac cycle is divided into two. We have the diastole, then we have systole. Diastole means relaxation, then systole means contraction. For example, the heart is made up of two sides, and each of the two sides has two chambers, which is the atrium and then the ventricle. So if the atrium contracts, we shall use the word as atriosystole. If the ventricle contracts, we shall use the word ventricle systole. Systole means contraction, then diastole means relaxation. So within the cardiac cycle, we define the cardiac cycle as the cardiac events, all those events that take place within the cardiac or within the heart, from one heartbeat to the next heartbeat, those events that take place that refer to as the cardiac cycle. We shall discuss them in details. Simply, the period of relaxation we term it as diastole, and the period of contraction we refer it as systole. So the first step during the cardiac cycle, since it's a cycle, imagine if it's a cycle, we can start from anywhere. So we can start like this is based on our anatomy, the previous lecture 1. You see that the heart is made up of two sides separated by a septum. It's made up of, this is the muscle. Then each of these sides, we have the atrium, then we have the ventricle. This is now the left, because you say that this left of the heart is now your right. Then now this side will be now the right side of the heart. This will be now the right atrium, then the right ventricle. This will be the left atrium, then the left ventricle. So if we start with the ventricular filling, we are meaning like this is now our ventricle. The ventricles, they need blood to enter within them because the previous one now has been pumped. What happens during ventricular filling? We shall see that this, we talked about the valves. These valves, we have two types. We have the AV valve, then we have the semilunar valves. For the start, we shall see that the AV valve will open because now the ventricles require blood to enter. Then the semilunar would have closed because of the pressure difference between the ventricle and then the corresponding blood vessel. So the atria will be relaxed, as we see here. As the atrium is relaxed, the AV valve opens. As it opens, blood will pass from now the atrium to the ventricle. That's during the ventricular filling. Then, still during ventricular filling, we have what we call the diastasis. During the diastasis is that the AV valve will still be open, then some blood will have to continue passing through from the atrium to the ventricle. And in that, the ventricle will end up being filled with blood. The next step would be now the atriosystole. With atriosystole, we shall see that the atrium will mainly contract, this atrium. As the atrium is contracting, it will end up pushing blood through the AV valves, entering into the ventricles. That's all about how blood it has always filled within. That's how blood is filled within the ventricle. So after blood has been filled within the ventricle, what next? You need now that blood which is in the ventricle to move into the respective blood vessels. For example, if it's on the right, that blood will move from the right ventricle to the pulmonary artery, because it has now to go to the lungs. If it was on the left side, then this blood in the ventricle has to move from the left ventricle to the aorta, and it has to go to the various parts of the body. So what happens after ventricular filling shall now go to the isometric, volumetric, ventricular contraction. What you are meaning with isovolumetric ventricular contraction, remember blood has been filled within the ventricles. So what next is that blood has to move away from the ventricles to the respective blood vessels, either the pulmonary artery or to the aorta. What happens, we call it as isovolumetric ventricular contraction. And here, iso means the same, volumetric is in terms of like blood. The blood will remain the same. Then, as the ventricles contract, so you can see, as the ventricles contract, pressure within the ventricles will be much more than in the respective blood vessels. This results into the opening of these semilunar valves. These semilunar valves will be opened, but the AV valve which separates the atrium and the ventricle will be closed. When the semilunar valve opens, then blood will be ejected into the respective blood vessels. It takes us to the third step that we call as ejection phase. And during ejection, remember, now the ventricles were filled with blood. They have undergone what they have called as isovolumetric ventricular contraction. As they contract, blood will be injected into the corresponding blood vessels. For example, if it's on the right, blood will go into the pulmonary artery. If it's on the left, blood will go into the aorta. Here, remember, the ventricles have contracted. As they contracted, the semilunar valves pressure within the ventricle will exceed that the respective blood vessels, forcing the semilunar valves opening. Hence, blood will be ejected into the corresponding blood vessels. So what happens after blood has moved away from, or has been pumped out from the ventricle? Then the ventricle has to relax. That brings us to our fourth phase that we call as isovolumetric ventricular relaxation. What is so important? We have this EDV, ESV, then the SV. EDV means the end diastolic volume, then ECV means the end systolic volume. End diastolic volume means the blood that is in the ventricle at the end of the diastole. Then the ECV means the blood that is in the ventricle at the end of the systole. So what we do, when you subtract blood that was in the ventricle during diastole minus the blood that is the ventricle during systole, it gives us what we call a stroke volume. And this stroke volume is now the amount of blood that will be ejected per 1 beat. It's always 70 mL per meter per mil at rest. So remember we talked about the fourth phase, that the first phase was about refilling, ventricular refilling, then the diastasis where blood had to enter into the ventricle still. Then from there we talked about the atrial systole by the atria contracted still, pushing blood into the ventricles. Then the ventricles were filled in with blood, whereby we talked about another stage called isovolumetric ventricular contraction. Then these ventricles, what happened after they contracted, they injected blood to the corresponding either pulmonary artery if it's on the left, if it's on the right, or to the aorta if it's on the left. So after blood has been ejected, what happens now? The ventricles will relax. The ventricles relaxing, we call it now, we term it as isovolumetric ventricular relaxation. Meaning iso means same, then volumetric, the volume is the same. ventricular, the ventricles will now relax. In that, this semilunar will both, the valves will be closed for this case. These valves should be closed, the AV valve and the semilunar valve. As these valves are closed, the ventricles will now relax. As they relax, we shall now go back to the same cycle like what we began with. Now the ventricles require blood to enter again. We shall again go back to our first step, which was filling. The ventricles now will be filled. After they have been filled with blood, still they undergo the atrial contraction. The atria will contract, filling blood into the ventricles. Then after blood has entered into the ventricles, still it will now contract. After it has contracted, it will now eject the blood into the corresponding blood vessels. Then from there again it repeats as a cycle, and that's all what we call the cardiac cycle. So this was the example that we have said. It will continue being a cycle. The ventricles being filled with blood. After they have been filled with blood, this is through the diastase and then the contraction of the atrium. Then systole, by now the ventricles contract, ejecting blood. And the whole step will repeat again. But the diastole is always longer than systole. That's all. Thanks. Till next lecture.